Hi. So now we want to discuss a full case planning with the Xrays and software. So this is a bilateral tibia vara with external rotation deformity. 18-year-old male complains of the deformity, and the deformity has increased with his growth spurt. Since 6 months, he has some mild pain in the knee, and obvious varus is seen. The thing to notice is the in squinting patella, which means an external rotation deformity. So the full length X-rays are done for planning. No sagittal deformities. For the rotation, clinically thigh foot axis is measured, which on the left side is 20 degrees and on the right side it is 15 degrees. Also do a CT rotational profile or to measure the exact deformity. So version in the femur is fine. All the external rotation deformity is in the tibia. On the right side, it is 38 degrees of external rotation, and on the left side, it is 42 degrees, and up to 20 is normal. So about 18 and 22 degrees deformities. We did a trauma CAT planning, shows LDFA is normal, and the deformity is all in the proximal tibia on both sides. The cora is found at the metaphyseal region, and doing an osteotomy there corrects the deformity pretty well. There's no limb length discrepancy. In squinting patella, no thrust. So we plan for the surgery. We usually apply the frame with simple hinge for ease of application and apply the DeftFix in the post-operative period. You can also apply the DeftFix intra-op. So the osteotomy is done a little further away from the cora to achieve stability at the proximal tibia. Now, this is the X-ray after application of DeftFix. Notice few things here. The beam, the X-ray needs to be focused in such a manner that the joint line is seen well. The beam center pointed out by the red arrow here. We place a radiopaque marker number 6 here. That is the beam center where the crosshairs of the X-rays meet. The yellow markers are the scaling object, which is 100 millimeters K wire, which we have placed here for the magnification. All the struts have been marked with the X-ray markers to identify the struts. So we can see three thin lines here. So this is strut number 1, and that is thin, thick, thin. Strut number 3. One does not need to remember all these codes. They are always there on the software for cross checking. Similarly, everything seen well on the lateral view. None of the struts are getting cut out. So this is how an ideal X-ray should be done for the depth fix. So now we can go ahead and for the program marking the struts on the X-ray case. So all the measurements have been entered. Here we need to identify the struts One way is to identify them by the X-ray markers. So the thin lines means strut number one, and strut number two is two thin and one thick, which means this one, two thin lines and one thick. Strut three, thin, thick, thin. Strut four, thin, thick, thick, thin, thick, thick. And strut five, thick, thin, thick. And strut six, thick, thick, thick. Now that is one way. Uh, the other way also to cross check is we know the most frontal strut which is going from mobile to the fixed string from left to right is strut number one. So these the one strut going that way is this one, and the other strut going to that from mobile to the fixed from left to right is this one. So either one of them is strut number one. But we also know from our the way we have placed it that strut number one is placed at position 42, which means it is to the left of the center bolts, which is our center bolt is the 0. So, and this one is going to the right. So by deduction also you should be able to identify the struts. So once you identified this as one, then it becomes easy. Going to the right is going to be strut number 2, then 3, that's 4, 5 and 6. So that's how we identify and then go ahead and mark the struts. Make sure you're following the fixed end is placed at the upper ring and the mobile end is placed at the distal ring. So, so place it centered on the circle, and the rest of the line is well centered on the strut. Strut number 2, thin, thin, thick. Drag the circle, place it well. Then strut number 3. Now over here, placement of the circle can be a little problem because we have already marked strut number 2. So you can uncheck strut number 2, place this well so that you are able to see that better. Now the joint here is not seen, so I'm going to right click and mark it with an arrow. And you can always now click on S2 again and strut 2 has come back. You mark strut number 4. The joint circle is not seen, so I'll mark it with an arrow. Place it well centered on the rest of the strut which is seen. Strut number 5. Then 6. Again, here I'm not able to see it well, so I'm just going to uncheck strut 1. Place this in a better manner. You can also change it to an arrow if required, if you're not able to see that well. So AP view marking is done. Double click and we are out. Double click on the lateral. So here again, the most frontal strut is going to be here. Now that these two are being overlapped, so you are not able to really make out which one is 1 and 2, but we are able to see, identify these thin, thin, thick. So this one is going to be strut number 2, and the one next to it is strut number 3, which is thin, thick, thin. So we'll start marking with the ones which we are able to identify well. There again, not able to see the circle, so just use an arrow. Strut number 4, thin, thick, thick. The mobile end again is getting overlapped, so I'm going to use an arrow. Strut number 5, strut number 6. The mobile end is overlapped, so I'm going to use an arrow. Place it so that it's well centered on the rest of the strut which is seen. So we can still go ahead and with the calculation without even marking these strut 1 and 2, but we are able to see them partly, so we should be able to mark it. And then we go ahead and calculate the frame. So lines are matching, slightly off here, slightly off here, but perfectly matching on the lateral view. So you can go back and fine tune these lines a little bit. So I'm going to uncheck these overlapped areas, convert them into arrows, and recalculate. Much better now. And then we can go ahead with the marking of mobile fragment. For bone orientation, we'll draw the mobile segment. So that's the osteotomy. On the lateral view, same thing, almost similar length of bone fragment is marked. And then we draw the bone axis. So here, since it's a metaphyseal deformity, we need to use the joint line for the AP view. So that's the green tree. Place these crosshairs on the joint, and like we had planned initially, the targeted MPTA is 87. So this is the medial angle which we need to change. So as we move the marker there, now this is the projected proximal axis. Place it well centered there. Mark the resection end of the osteotomy and the shaft for the distal mobile fragment. One can extend this line and identify where the cora is coming for this. So as per our plan, the cora was slightly more proximal. So I need to modify this slightly. Yeah, that is more like it. Now if one can notice, there's already a translation noted between these two axes. That is the amount of translation which would be required when we are using the osteotomy rule number 2. In the sagittal view, there is no deformity to be corrected, so we want that angle to be 0. So move your line such that we get a 0 degree line, 0 degree angulation between them. When I right click on this point, it toggles. So now it is 0, but the lines are translated. So I just need to move this tree to get these two axes collinear. So no more translation going to happen on the sagittal plane because there's no correction happening there. And then we can go ahead and mark the structure at risk, which is the concave side here. We are also going to correct some rotational deformity. So in this case, we will be internally rotating the limb. So this fragment is going to move to the right. So you can place the structure at risk on the anterior side there or midline, whichever you choose will be the correct thing. And go ahead and calculate. Now the fragment, the deformity is corrected. The mobile fragment has become collinear with the proximal axis. No movement happening in the sagittal plane. Now because this translation is happening using the osteotomy rule number 2, we should avoid any clash. To avoid any clash at the osteotomy between the fragments, we will add distraction. Also, it's a good idea whenever we are doing a rotational correction to add distraction to get a smooth regenerate. You can always compress at the end by using the add residual program. So here this was the right leg. The deformity was external rotation. So we need to move the foot to the right. So we will use this arrow to correct the rotation. We have already calculated the rotation deformity is around 15 degrees. And then you can go ahead and print the schedule. Add the date and we have got a program for 14 days, and no red marks, no red flags. So all the struts are well within the limit and do not need any adjustment. So this is after 7 days of distraction. Some distraction has happened at the osteotomy. Little bit of translation has also happened. Earlier, the center bolts were well aligned. Now the middle ring center bolts are slightly turned. So some rotation correction has also happened. And we go ahead and at the end of 14 days, the full correction has been achieved. The HK is now corrected. Mechanical axis is passing through the center of the knee. This translation is intentional because of the osteotomy being further away from the cora. So the osteotomy rule number 2 has come into play. Already some regenerate is forming, and then we go ahead and add some compression because there was no LLD. We do not want to distract him too much. So go ahead, get back to the program, and now add residual. Everything else being good, you just add 5 mm of compression. The red contour has moved closer to the osteotomy. Go ahead and print the schedule. Step 2, and that's the amount of compression required. So one can go ahead and do it in gradually in 5 days, but since this is just compression, we have done it over a couple of hours in the OPD setting itself and finished all the compression acutely, and that is at the end of 5 mm of compression. So everything looking good. One can go ahead and finalize the correction. That is the rotational correction. So patella forward. Now the foot is slightly externally rotated, which is what it should be. And on the uncorrected left side with the patella forward, the foot is external. The bow is also visually corrected. Go ahead and change the hexapod struts to straight rods. Now, because these rings are not perfectly parallel to each other and they are also translated, one should use coupled washers combination or universal hinge or simple hinges at one of the ends and coupled washers on the other end to keep the rods straight and avoiding any undue tension between the two rings. So that's after conversion of the rods. Thank you.